Hello, we are live, and hello, good evening. I think we're live now, actually. Yes, hey. I'm just gonna link you on now, and yes. Hi, Lina. How you doing? So, just to introduce myself. And we have first of all, I'm going to introduce myself and then introduce a lovely pregnancy without fear. This is Udawak Udondem, and I am a birth doula, practitioner specializing in Vigo therapy and pregnancy massage. And I am joined with the lovely Delia, Pregnancy Without Fear. Would you like to introduce yourself and say a little bit about you?
Thank you, Udwak, for inviting me. I am a qualified midwife, I am a former doula, psychotherapist, podcast host, VBAC coach. I've been doing that, I've been on this path since 1993, so I've seen quite a few babies born.
Yes, so we want to kind of, so let's just kind of start from the beginning. I've kind of given it a little introduction about myself. I've been a doula. I started my journey as a doula about 15 years ago. And surprisingly, I met Delia through listening to an local radio station. She was at a local radio station talking about the role of a doula. And that was really my moment of who I wanted to become in terms of helping support women during pregnancy. So it's interesting that we've connected again through social media, and actually combined, we have at least, I think, about 40 years of experience supporting women, which when you combine it is actually really interesting or phenomenal in many ways. And we were, as normal, we have a great relationship. We've known each other for over about 15 years now, and we've shared stories. Delia has been a mentor for me in my journey in my work as a doula, and I greatly appreciate her being around. And often, regularly, we have conversations about life, but mainly about supporting women, how we can best support women. And during this pandemic, since the shutdown, we've definitely been talking about just understanding women and how they are able to be supported through social media, through online. And over the past 3 months, so many things has happened. And the conversation we had last week really kind of wanted us to share and talk about the discussion we were having, because I thought maybe it would be something that the audience or anybody who is expecting will kind of take value from. So my experience as a doula has come from my own experience, and combined with that journey, I kind of stumbled on Vigo therapy, which is really about womb healing. And I went into that practice because I felt not every birth is joyful or the birth outcome is joyful. There is a lot of trauma in birth, which it's about really helping the mother in terms of healing. And the Vigo therapy for me was really a good medium to really understand how to heal the womb after trauma, after birth. And it was a very interesting modality, because like most healing modalities, you have to become a student first. And with the Vigo, I had to train and do the self-care and actually look in terms of my own healing. And that really, really helped me expand the healing, or working towards supporting women in their own healing journey. And it expanded into touch therapy, which in the form of pregnancy massage. And over the years, 15 years of working with women in different modalities of my practice, whether it's as a doula, Vigo, or pregnancy massage, it's really kind of helped me understand that support is very key, and touch therapy is really essential, or togetherness and listening, and ways of supporting the expectant mother on her journey, because it is really a journey that she kind of goes through. So the work I have had with Delia has been learning, definitely about learning, because her experience or her work has, you know, doubled in my time as a doula. And I really appreciate the work and what she has to say in her experience. So that's a little bit about me. And yes, please, Delia, share anything you have in terms of what you know, your journey so far.
Wow, my journey so far is well, I had a seizure in 2016, I think. No, sorry, 2007. And I was on steroids, etc. And it's obviously the seizure has rendered me disabled now, so I can't really go out anywhere and be the active doula that I was. So a lot of my work now is online. Pregnancy Without Fear is a platform really for women to understand, learn, acquire information from individuals who may be in the pregnancy world, and also outside of it, who can just feel empowered by the information that they receive. And so, like you were saying, the discussion that we had earlier on this week in relation to pregnant women and how this time is affecting pregnant women is quite crucial.
Yeah. So, I mean, a lot of the discussion is going to come from the role of a doula and also my experience as a massage therapist, because being hands-on has been another way of me learning how to support women and understanding the body. And I know definitely during this time, it's about distancing ourselves. And one thing I know definitely is in pregnancy, or the journey of a woman going through a pregnancy, is that it's really important that she's supported or she's surrounded by people who support her. And now in Western culture, it's either going to be seen as your midwife, your family, and friends. And this past 3 months, that's completely changed. And that whole sense of support has been literally just taken away, and has in many circumstances, women with families or without, or have been in a distance, distancing from each other, have had to learn to really adjust on how to find that support.
Yes.
And the main source right now has been through social media. We are part of a great community of doulas, Black doulas in the UK, which is phenomenal. And we have been definitely working behind the scenes of this social media in really kind of being open and opening our doors and our ears to mothers, because we can't be with them on a one-to-one. Not all, you know, for myself, I know that's happening, but I know there's a lot of doulas who are still on the front line working in hospitals supporting women. I know yourself, your doula work is now kind of done online, and we're just finding ways how to really change that dynamics. And 3 months has kind of passed, and we're learning as we go along how to adapt. Yes. And we're learning how to really reach the needs of these mothers. And definitely a lot of the skills of our doula role has really been about listening. So that hasn't changed at all. It's really how can we give them the skills that we would be one-to-one, and let them feel more independent and confident and empower them in that way. So it's always still been about empowering women, but now we have to kind of, I feel like in a way they have to really step up and kind of gain that strength, which they felt they never really had because of the closure of the hospitals to a degree. Yes. And the distance or the lack of continuous support from midwives, just the antenatal appointments. So I know that it's a new journey for a lot of women. You can see it as a challenge in a bad way, or it can be seen as a challenge in a good way, because it can bring something out of you that you may never have felt that you had. Another thing we wanted to we talked about was really our the surroundings, the negativity, and how to deal with this negativity. And the role of my work as a therapist, definitely as a massage therapist in doing touch healing, is that so even though we hear the information through social media, it actually really affects us not only mentally and emotionally, but it actually affects us physically.
Yes.
And that in turn also affects the mother's pregnancy journey. And it's really a case of how to really help mothers. Um, okay. Hey, Charmaine, I'm just kind of reading a few messages. I will answer that question. Good point. Thank you for letting me know, Charmaine, that how to really help them kind of be present and dismantle or detach themselves from the whole dynamics and negativity that they're taking on. Because right now, you know, we've been shut down, or it's been disconnected from a lot of the things that we really women need in order to have a good pregnancy.
And I think it's the need, because when you're pregnant, you always need something or someone. And when it's not there freely, then it does become difficult. And I think with this situation, the COVID and the hospital situation, it really does put pressure. It's a mental weight. It's the body is still growing the baby regardless.
Yeah.
But it's what's going on up here that we have to be concerned about. And when you've got a woman being told, oh, you've got gestational diabetes, you've got preeclampsia, you've got hypertension, your placenta's low, all these little issues that come up, and she has to find a way to be able to say, yes, all right, then these are the issues in my pregnancy and I've got to deal with that. But I've got to deal with the fact that I can't have a doula. I've got to deal with the fact that possibly I can't have a home birth. I've got to deal with the fact that when I go into the hospital, will I get the virus? You understand? And it goes on and on. And she's creating these scenarios in her mind from now of what if, suppose this. And so after a while, it becomes more and more negative, and she's really just going down this rabbit hole all by herself. And no one else knows about it because she doesn't want to tell anyone, just in case someone just says, oh, you're always complaining, or just in case someone says, oh, look, just leave it for now and we'll deal with it afterwards. She's not being listened to. And we've got to listen to her. In this time, we have to listen to her.
I'm also coming from a point of the therapist in terms of working with the mother and really helping her connect with her body. So a lot of the work I come with, either in my role as a doula, is how is she connecting with her body? Because there's the body that's also kind of doing a lot of the work, you know, carrying the baby, nurturing the baby, growing the baby. And it's really important that she starts putting the head and the body together and letting that flow, and letting that flow and let that communicate. In terms of questions I kind of tend to ask women is, how are you feeling? You know, because a lot of the time they'll wait for someone to tell them, this is how you feel, this is what you should be doing, or this is how this is what's happening to your pregnancy. You may have this challenge and it may hinder your birthing process or your birth outcome. So a lot of the times is about how to empower them in terms of you hold a lot of the answers, most of the answers in terms of how you're feeling and how to connect. And right now it's really important that women learn to touch, get in connection with their head and their body. You know, and really feel that, and it really helps them cope with a lot of the situations today. It's beneficial for everybody in terms of how we are feeling, because a lot of times we don't always know how we're feeling. We kind of tend to disregard it because we're very busy in our lifestyle, whether it's working, family, or any other situation. So it's really important, and where I'm coming from when I listen to mothers and they talk about what the doctor said here, or what they can't do here, or what the midwife. I always come to say, well, how are you feeling? How do you feel about that? And it
Yes.
stops them and it makes them think, well, how am I feeling? You know, and that's where that ball starts rolling in terms of mindfulness. You
I
know,
was just saying, the word just was in my head, being
yeah,
mindful,
yeah,
because that, I mean, for the mothers, or should I say, for the pregnant ones that I have spoken to, I always do mention mindfulness to them. I say to them, look, the minute you start to get a particular feeling and you can physically feel that feeling,
mm-hmm.
anger, sadness, whatever, ask yourself the question before you allow it to go much further and possibly overwhelm you. Stop for a moment and
Yeah,
ask yourself, where did that feeling come from? Why am I thinking that way? Because sometimes, and I'm just talking in general, we're in the shopping center, you're walking through the shopping center, and there's different shops and they're all playing different types of music. You're not taking any notice of the music. But then when you get home, all of a sudden you're singing a song,
mm-hmm.
and you're asking yourself, where did I get, why am I singing that song? Not realizing that all it done was the subconscious just absorbed it
Yeah, yeah,
like a sponge. And then now you are just singing it at home, but not realizing that, yeah, your body took it in whilst you were walking through the mall. And it's the same thing with pregnancy. Um, you've got the virus, and then you've got the media telling you how many people have passed, and you know how many people are being affected. And then you've got the situation with George Floyd and what happened to him. And you've got us having to help pregnant women to try and minimize the negativity by not listening to the news, not reading, not going online.
you know, this is
And
really, yeah. I mean, one thing it's really important that regardless of whether we are prior to lockdown, which is really important, is learning your boundaries. You know,
yeah,
learning your boundaries. And what I think, I mean, my background is Africa, Nigeria, and my mother had 6 children, and I have learned a lot of her stories in terms of her pregnancy and her postpartum, which is really just as important as the pregnancy journey. And one thing I learned is how in many, well, in my culture, for the pregnant women, mother, she is surrounded by the family, the village, you know, and in that scenario, she's been nurtured by songs, stories, you know, therapy such as massaging, and um, and they just kind of getting her ready and teaching her by doing the act themselves to become a mother, you know, because sometimes, you know, right now there's loads of books on how to become this, and, you know, 90 days of motherhood and everything.
mm,
But generally it was always shared by, you know, women. So that word for me, togetherness, the togetherness of other women sharing that story is also protecting her from the outside in terms of what she doesn't need to it's not important for her in her pregnancy process.
and
And
that's exactly the role, because if we can get mothers or women who are expecting to focus on the pregnancy,
mm-hmm.
and those who are around her should also be getting her to focus on the pregnancy, not focusing on what's going on outside of
Yeah.
her. Because when she goes into labor, she'll be focusing on labor. She won't be focusing on who knocked on the door, why is the phone ringing. It's not going to be like that. She has to focus solely on labor.
So
So while she's pregnant,
mm-hmm.
it's got to be the same principle. She is focused on how to develop her baby. So I'm saying to mothers, focus on communicating with your baby. And
Yeah.
I had one mother, and I have to say mother because she's it was her third child, and she said, you know, the first two, I really didn't take much notice, but this time, I felt the flutter. Um, they said that I've got gestational diabetes. And then I said to her, and how are you communicating? She goes, oh, well, I'm only 9 weeks. And I said to her, it doesn't matter even if you were 6 weeks. Focus on communicating with your child. Your baby will not hear you until after 25 weeks. However, prior to those 25 weeks, your baby is developing based upon the vibration of you, your heartbeat, how you breathe, how you swallow, when you walk. It's all about vibration. So depending upon what type of environment you are then letting your baby know that things are okay. So if you're, I don't want to say, happy, but if you're relaxed, if you're calm, if you're happy, then baby will feel that. Baby doesn't have to hear you to know that. Baby will feel that based upon how you are, hormonally, psychologically, and physically. And this is what I teach mothers. I say to them that you are your baby's environment.
Exactly. It's really important that she connects to that understanding that, the cycle or the circle that she's in, it really, or, she's the one that really kind of creates that environment.
Yes.
However, as we know, women of today, even it can be very challenging to kind of maintain that or kind of put that into practice, because from a cultural background, pregnancy doesn't just start from conception. Sometimes it actually starts prior to conception, your readiness, your preparedness, and it does actually take some time to get there, get to the physical stage of pregnancy. And in that time, couples who actually prepare themselves in that way are used to that practice of focusing and sending that energy to the baby. However, not everyone has that understanding at that particular time that is what's needed, especially when we are working in an environment where we have jobs, and now so being at home, and for women who have families and still have to work, it's very challenging. I am also experiencing that, working from home and maintaining schoolwork and the family dynamics, and also my own dynamics, because now we're all kind of contained 24/7. So it's really, I definitely do feel one of the first key practice that's really essential that could help them start that journey, as we said earlier, is the mindfulness of how they're feeling, and also the mindfulness of what they are feeling in their bodies, and acknowledging what that is, and learning to let go of that, learning to kind of dismantle that. Because as we know, it's like when you throw a pebble in a pond, it ripples. And that ripple effect could be seen as your experiences in life, or good or bad. So it's a case of how do we make that pond nice and clear, and you can see your reflection, and you're happy with that reflection that you see. It's the first step is really mindfulness, and actually the most important step as well is breathing, learning how to breathe through that mindfulness. And that in itself,
and it's breathing through that anxiety as well, because there's a lot of anxiety, and when there's anxiety, these women will tend to maybe hyperventilate. Do you know what I'm saying? And if they're not getting the information that they would like to hear because they can't communicate with anyone at the hospital, there's a lot of expectant ones who say that they'll be phoning and phoning and phoning
all the time,
and they're not getting anywhere, and it's stressing them out because they might be 38 weeks or 39 weeks, but now many of them are being told that they're going to be induced early. And a lot of them are saying, well, is there a good reason why I should be induced at 38 weeks, 39 weeks? when they know that they can go over 40 weeks.
Yeah.
Yeah. But I feel that possibly because of the situation in the hospital.
Yeah, I mean, definitely that's happening since the shutdown. As we know, a lot of hospitals have made their priorities due to the COVID-19. A lot of the wards and hospitals and birth centers have changed their priorities. And even when hospitals are open and are working, it has changed, and the restrictions, as we all know, has completely changed, which is making it very challenging for mothers and couples to really have the birth that they want and envisioned. It's now a case of compromising, you know, and luckily there's some fantastic doulas out there still doing the work, who are able to support mothers who have chosen them as being the only birthing partner, to be able to be there for them, which is
good, because when you think
fantastic.
about it,
Yeah,
you know, if a mother trusts her doula enough to say, look, no, I'd like you to come to my home when I'm in labor, you know, I think it's beautiful, because it means then that this mother will go through her labor because she knows she's got the support.
yeah,
Yeah. And really, if a doula is able to go to the home and not be fearful of the virus as well, then hey. But with the lockdown, kind of, it's kind of eased up a bit in one way or another, hasn't it? So I really don't know where this is leading to, other than the fact that you've got these pregnant women thinking about the virus, whether or not they're going to get the virus, will their baby get the virus, only having one support in when they're in labor. So they've got to choose. If they've had a doula, they've got to choose between the doula and father to be. And that can be hard, you know. But I spoke to a couple of days ago, and they said that they had their doula on iPad, so the doula was able to still give them some tips and, you know, get her through. And we just have to use our common sense, really, in certain ways. Right now it's technology that's doing it. So if we can use technology in whatever way we can, that it becomes advantageous to what we're doing, then there shouldn't be too much of an issue. It's when a father to be is with the mother and he has no clue, he has no support, things are being done, but no one's saying to him or asking him anything. They're just doing it and saying it's for the sake of the baby. So being negative, this is a very negative time. And so pregnant ones have to be able to focus on realizing that this situation they have no control over, but they do have control over their feelings.
So I just got a message from one doula. Hello, Anita. How you doing? Saying that even some hospitals would even allow a virtual doula support in the environment, which is actually really quite surprising. I know there's a lot of hospitals having their own rules.
Making their own rules.
Yeah, making their own rules.
Yeah.
And what I would say to that, with mothers expecting on now listening, is, you know, ask them for more information on that. You know, do go out and ask them more information, and how, just have that information and kind of process it. And definitely, you know, as you know, there's a lot of doulas online who are happy to answer your questions on this. But actually, that's really surprising that they would even allow the virtual doula support. Why?
Yeah, because you know, I think because of this urgency with the virus, it makes it very difficult. So they've had to set certain protocols and guidelines there, so that it's relevant, but also it shows that they still are giving the best care. No, I have to say that.
Yeah,
I have to say, because that's basically what it
what
is.
their intention.
Whatever decision they make, it's to say, look, this was the best care that we could give.
Mm-hmm.
Yeah. So mothers have to be prepared for what that hospital that they're booked with,
Mm-hmm.
yeah,
I mean,
is going to be able to do.
yeah, I mean,
And that's why I say to mothers, keep in contact with your hospital, go on the website and look at if there are any changes. So then that way you can prepare. There's no point in saying, oh, at week 30 or 35, they said this, and then by week 39, they've changed it. Then you go into labor at week 40, and then when you get there, they're telling you, no, that's not what it is anymore.
yeah. I know definitely. I've spoken to a young couple a couple of weeks ago who were looking to have a home birth, and they are actually, you know, I know some birth centers are now opening, and I always say to them, make sure you are in constant contact because things are changing. I know definitely 3 months when the shutdown had happened, you know, nobody knew how to kind of, like you said, knew how to best deal with the situation, and also, but really ultimately it was about them reducing the likelihood of mothers and babies being infected.
Yeah.
So it was a very intense, immediate shutdown in all aspects. And I know things happened week by week in terms of information globally as to the outcomes of the viruses, of women having the viruses, and just kind of testing things out. So as you know, most information that we get in the birth world is through testing and trials
Yes.
that they go through. That would span months or years. Now, literally, a lot of the trials that we were getting from this were literally a week by week update. And so in that sense, that's understandable. Now, 3 months on, things are slowly lifting because they can see from, 3 months of change, or either whether it's steady or it's escalated or actually reduced in terms of cases of mothers and baby cases. It's they now know really, or shall I say, the thinkings a lot more calmer, and they're able to kind of think things through, process things a little bit more thoroughly to kind of give a better outcome. And I know definitely I've joined a few hospital meetings and listened to midwives and doctors, and they also are, the language which I'm getting is that they are now a lot more common and have a better way to support mothers.
Yes.
Without panicking, shall we say,
Yeah.
Pandemic.
And just to say as well, that the RCOG, the Royal College of Obstetricians and Gynecologists, have on their website, it states that for mothers who want to breastfeed, they can, because there has been no research to show that if a mother had the COVID, it would be transferred to baby.
Yeah.
So it's just something that mothers should know, but they should also go on that website and look through it as well.
Yeah.
You know, even the RCM, look at the RCM website and read what they're saying in relation to breastfeeding and COVID, because a lot of mothers, obviously, when they've had their baby, they want to breastfeed.
Yeah.
And they're more likely worrying, well, how can I, will my baby get it? And if I've got it, what will happen? There's so much things, you know, and it's a lot of worry. It really is a lot of worrying. And like I said, it's worrying about that alone, let alone the issues that you may have in your pregnancy.
Yeah.
It's a lot.
So coming back to how to kind of, one of the things we wanted to kind of touch about as well is the negativity, because, now being at home 24/7, the way we access ourselves to the world is through social media,
Yes.
Things, like Instagram and Facebook. And, a week ago today for me was when I learned of the news of George Floyd. And it was a very powerful, for me, first of all, I'm very mindful as to how I take information, because I know it's very, very powerful, and I know who I am in terms of what I know I can deal with and what I want to deal with, what I choose to deal with. And that's really important, that we all need to kind of acknowledge within ourselves, and like, how much do we want to take information because of who we are, you know, in the world. You know, I'm a mother, I'm a therapist, I work with pregnant women, so I know and understand the whole concept of energy and how it really works. So for me, I'm very mindful that the most important element that I need to be doing is spending time out in nature, because I know how that really helps me help everyone else in my tribe, shall I say. But not a lot of people realize that, you know, as soon as you pick up, you know, your phone, handsets, that's it. You've kind of opened yourself up. And that could be as first thing in the morning, you know, whether it's 8 o'clock or, you know, to last thing at night. And if you really think about it, there's times when I can be doing an overload of being on the phone. It's how many hours are you really processing the information? Right now, we know, for example, Instagram is very much a place where things can only, for you to absorb information, is about 5 seconds or so. So in that 5 seconds, how much information are you taking every 5 seconds or every 10 minutes? And with the watching a video, I didn't watch it completely, because luckily I was told, you know, literally what was the outcome of that video. I choose not to partake in that, because for me, I didn't feel, how is it going to benefit me watching it live or watching?
That's what I said.
You know, and I think it's really important that we learn to ask ourselves, how are things benefiting us when we take it on in terms of social media?
But what can you do? Because there are things that you can do, but at the same time, you do have to be assessing yourself and the feelings that you are acquiring based upon it. You know, you're hearing some people are angry, you're hearing some people are petrified, you're hearing some people are scared. Those three words, petrified, scared, angry, they produce adrenaline.
So back again, it's like, okay, how, because most of the time they may not know when that the emotion kicked in or where it's coming from. I know definitely watching the video and everything about it is very triggering. I know it triggered me as a mother. You know, I'm a mother of boys, so that triggered that in me. I woke up the next day feeling all these emotions of my children, motherhood, and it reminded me that I'm a Black woman, with knowing that there are challenges not only in America but here where I am in my own environment. So, and I had to really stop and rethink, where do I really want to go with this, and how am I feeling, how is it holding in my body? And because of the work I do in terms of releasing and, you know, understanding the energies of the body, it's really important that, and it's unfortunate that we're not able to, as therapists, as a therapist and as a doula, not be with the client on a one-to-one and understand that. But it's really important that you, as a consumer in social media, whether you're expecting, more so that you're expecting, and a parent, that you really be mindful of what you're taking in, because it's really powerful, the energy that we are taking in through social media. And
as well as that, it's your energy. I tell mothers, or I tell pregnant women, everything that you feel, everything that you think
the baby feels
will be a part of the development of the baby.
Exactly.
You can't separate how you feel. You can't separate what you're thinking from the fact that this child is being developed from you. So you have to look at, if I'm sad all the time, if I'm angry, if I'm worried, then your baby is being developed on worry.
Yeah.
You understand? Because It's hormones. And we forget that because we use hormones for labor, oxytocin, prostaglandin, estrogen. These are the hormones that we're using in relation to labor. However, we need to be looking at hormones when you are when you've heard of negative news.
And what the hormones that are kicking in, what the hormones that are
seriously,
what are the hormones?
We don't realize this. We might feel angry, and we feel that negativity, but not understanding that that feeling is developing your baby.
Yeah.
That's what we have to grasp. That feeling is part of your baby's development. Your baby is going to be feeling that too.
Yeah. Because
you are a chemical makeup. Hormones are chemicals.
Yes, definitely, so true.
Yeah.
Definitely. And that was one of the things I was really kind of feeling in terms of, you know, when you see the pictures of the protests and women, mainly women protesting, it's like not everyone would have to agree with my thoughts. I don't feel that we are should be always out there protesting. If we're mothers, if we're expecting, I just feel our job already that we're doing is hard enough, and we're taking on a lot more.
Much more. And we don't need to.
We don't need to. And this is another thing I would like to say to women, you know, ask ourselves, do we need to be there? Or how am I serving? Or how other ways we serve the community in that way, which is a lot more powerful. And the hormones that need the balance. Another word that comes to mind is balance. How is there balance? Because you are going to have a group of people who have that energy of warriorship. Then you have the group of people who are really about thinking and strategizing how to make the situation happen. At the same time, we have to also acknowledge that there has to be a group of people that has to be very nurturing and loving, you know. And what comes to mind is, for example, Mother Teresa wasn't on the front line fighting. She was the one healing and nurturing, because there needs to be an element of love, compassion, as well as, you know, the hormones, adrenaline, in order to have that energy to kind of put that force and that message across.
Yeah.
So it's really important knowing where is your power and where is your power, where is it coming from, and what can you how to utilize your power. And as women, not everyone has the power to do it physically, you know,
because the thing is, as females, we have different levels of power, and then as a mother you have different levels of power. You know, so it really is about looking at yourself and asking yourself, the power, what is it? What type of power do I have? Is it the power that keeps quiet? Is it the power that advises? Is it because we tend to use the word power in its physical form. Power doesn't come just in physical.
Exactly.
Yeah. Power can be silence. Power can be you don't say anything. Power can be I'm going to shout out to the whole world. Yeah. Power can be I'm going to have 3, 4, 5, 6, 7 children. Power can be I'm only going to have one.
Yeah. So with that in mind, and I know definitely since it's been a week since all of this emotion's been happening, and I can really feel the sense that now it's been a bit of a, you know, it's like, you know, when you have your birthday and they throw you up, is it called bumps? That element of bumps, you know, like, whoa. And then now that you've calmed down and you're sitting there standing, you realize, okay, where's my sense of direction?
Yeah.
And right now, we're all now understanding our sense of direction, because we realize that we don't have the power to go and be at the front, because we realize, and that's a good thing once we recognize that, because when we do recognize that, we are really learning who we are. And we're really learning what is our purpose, and how we navigate our purpose in that direction that we need to go for.
Yes.
And so once more of us are able to do that every day, and more so the expected mother, she's able to navigate her journey intuitively, you know, holistically, and have that balance, you know. And it's about, like I said, as we talked about in the beginning, mindfulness, setting the boundaries and knowing what really is for you.
Yeah.
My sister always said, you know, choose your battles wisely. You're not meant to be fighting every single battle, and it's very hard to do. And it sees the balance of us, you know, because we don't need to always have to be aggressive, which is a hormone active, a hormone that
exactly
not really needed within us, especially when we're mothers, especially when we're breastfeeding, most importantly, because definitely that will drain us as mothers, and more so especially when we're on our pregnancy journey, whatever trimester we're in. If it's most, I mean, for me, I feel if you're in the first trimester, it's really about nothing, doing nothing, resting, you know.
Just totally relaxing,
responsible, you
know, and connecting. Response versus reaction. I believe that. And it's I think this time round, in this time that we are in, it really is a trying and testing time, because everyone is so used to not really being given the opportunity to think for themselves, to do for themselves. Now people have to think
a lot more.
Yeah. I think one situation that I feel is quite concerning is domestic violence, and also mothers or expectant women who are in households where possibly there's a lot of in-house bickering, and she's not really getting the opportunity to get the rest that she needs, to be pampered, you know. And I feel that I'm just speaking to families out there that do have someone who's carrying a child, that she is special, her child is special, and we need to protect her. There's no point waiting until Labor Day. There's no point in waiting until Labor Day. Protect her from now whilst she is pregnant, and keep her away from anything that would affect her negatively. So if she doesn't need to hear about something happening up north that was not good, then there's no need to tell her. If anything, find something that makes her laugh, makes her feel good, and then that way you know that she's getting the best and she's trying to be the best. I speak to fathers to be as well. The fact that I remember one mother was saying to me that she was suffering from hyperemesis gravidarum, basically vomiting and nausea, just for anyone who doesn't know. But she was doing it practically every single day, and she was getting weaker and weaker. But every time that she would go to the toilet, her partner would come in and he would be like mocking her and laughing at her, and it kind of made her feel really belittled. And it got to a point where she, after a while, had to sleep somewhere in another part of the house, because she just felt that she'd rather be on her own dealing with this than knowing that she's got the support, but the support isn't there in the way that she thought it would be. And so there's a lot of pregnant women who possibly are in that situation where they have somebody with them, they can see them physically there,
but
they're not.
I've definitely come across women who are in that same situation, where there are people in the house who role is to protect them, to nurture them, and to be them for them, but actually it's the complete opposite. You know, it's the complete opposite. It's just, you might also just say, I must just be doing this on my own, because you're not there to support.
You're not there. And this is the time where you should be there. He should be there. Yeah.
Yeah.
So I recommend that mothers should have baths or showers and then have a massage.
Yeah.
Head, shoulders, hands and feet.
Yeah.
So then that way she feels good. It's all about making her feel good. Cooking lovely meals for her so she feels good. She feels special. She feels loved. Giving her hugs. Not just holding her hand, but no, giving a lovely big bear hug and saying, oh, you are just so beautiful. You are awesome. You are, and a woman really feeds off of that. She feeds from that. But if we're not giving her that sort of feeling, then it doesn't, it's not going to help her. And that will also lead to how her labor will be. Because if she's not getting the support in her pregnancy, she then has to start looking for the support in her labor. And a lot of the times she'll just give up and say, do you know what? I'm going into hospital. I'm going to have an epidural. She'll just take everything.
Give the power. She'll just give the power away.
Give the power away.
Yeah. And actually, talking about the word, we're nearly coming to an end. If anyone wants to have any questions, actually, to ask us, now's the time. To do this 40 years of experience.
Yes, please.
Please ask us questions. You're more than welcome.
All these doulas that are up on here, I know some of these doulas,
ask your questions, but
taking all the information.
Yes, definitely.
And not asking any questions. And I'm sure you've
questions.
all gone through and had experiences and possibly have not been able to get the right answer. And we may have a solution. We may have something that makes you say, that sounds good. But it's important that as doulas, we're supposed to be taking information in all the time.
Yeah. So coming from, this is my therapist head coming in as, working with the body is, how can the individual, the mother, really kind of make that reality for herself, and we've definitely touched about, I've just got a question, a very interesting question. Any tips on managing anxiety, miscarriage of the first trimester? I think, can I get back to that question after I've actually answered that? Because it'd be really, I hope it will actually marry to your question. But as a therapist, and one was a really good, I just want to kind of share a really good visual, if you can kind of visualize, as we all know, there's a story of film about the Invisible Man. And I'm sure anyone has probably seen the film, The Invisible Man. And when, you've seen a scene where he's drinking water and you can see the liquid going into him. So, and that's him with a digestive system. That's really his digestive system getting activated. One thing that how we take information is through our nervous system. We actually, through our skin.
Yes.
And if you can imagine like someone just kind of injecting a dye into our nervous system, which is actually just veins that is literally on every single part of our body, it's going to actually fill every single tip. It kind of goes through our whole body and to every single tip that we're feeling. If we can say every single hair that will kind of stand up, that is actually sending messages from the outside world how we're feeling. So when we feel tense or when we don't feel love, it sends a message, and like I said, it holds into our skin.
It does.
Which sends messages into the nervous system, into any other levels of our being. And one of the ways, like we touched upon, would be, through mindfulness and through breathing. Because when you're breathing, you're actually sending, oxygen to the body to really counteract or exchange, the carbon dioxide. And as we know, oxygen relaxes our body. So, when we do feel anxiety, breathing, it's really a good way to help.
Breathing, and definitely trying to minimize it, because anxiety, worry, stress are all
Mm-hmm.
things that can actually break the immune system down, which
Yeah,
makes you susceptible to illness.
exactly.
It's something that I'm sure many of us know, but it's important for us to really remember that when we are worried and it's overwhelming you, when you're anxious and it's overwhelming you, when it comes to miscarrying, especially in the first trimester, every pregnancy is different.
Mm-hmm.
And so for mothers who have experienced this and are anxious, it's about really, if you can get therapy, get therapy.
Mm-hmm.
Don't just overlook it and feel that, oh, I must get pregnant again. And when you do get pregnant again, when you do conceive, you then start worrying that possibly you have another miscarriage. So it's important that you speak to a professional about how you're feeling, what you're thinking. And then that way, with that combined with you conceiving or have conceived, it really helps to be able to then continue without feeling that it's going to happen again. But if you're thinking that way,
Mm-hmm.
even though you have conceived, if you continue thinking that way, the brain is telling the body to get rid of.
Mm-hmm. For survival mode.
Yes.
So
So you
yeah.
have to actually think the opposite and not think, oh, is this going to happen again? No, this is not going to happen again. I'm enjoying myself. I've been blessed again. I've got a lovely baby in my womb. And you've got to be telling yourself that everything is okay. Telling your baby, regardless of 6 weeks, 9 weeks, 10 weeks, telling yourself, telling your baby, everything is fine. Everything's going good. I love you so much. And you keep talking to yourself.
It's very challenging with dealing with anxiety due to a post miscarriage, because first of
Yes.
all, unless you know why the miscarriage happened, which is one of the first trimester, the likelihood of miscarriage happening is high compared to any other trimester.
Yeah.
Not only the first trimester, but it's just more common, and that could be for many reasons. So, you know, like Delia said, working with your mind, and I think in a way affirmations is really going to help you.
Yeah.
But also understanding what happened prior could help you, and how you what steps you took
Yes.
prior to getting yourself ready, whether you allowed yourself to have the rest, because carrying even for that short term and having a pregnancy loss is a very major thing that your body, mind, and your spirit and your emotion has to really deal with.
Yes.
So it's really where only you know where you came from and where you are in that journey. But definitely, resting the mind and really try not to fear of the possibilities of things that could happen, which you really do not know can happen. As we know, fear
Exactly. And that's the whole
really,
point.
yeah,
You're creating things in your mind
yeah. But it's
that
very
possibly
difficult. It's
won't
very
exist.
difficult.
And it is very difficult. I mean,
Mm.
Charmaine was saying, it's very challenging.
Yeah.
And it is. However, it's a bit like um, cutting through bushes. You're either going to cut through the bush to get where you need to go,
Mm.
or you're going to be there saying, oh, I don't know how I'm going to
Yeah.
do this. Yeah,
Be
so
present, just one day, like 1 minute at a time, 1 hour at a time. Something, the most important element is now.
yeah,
And it's really understanding how you are feeling now. And
now,
knowing that this is what I also talk with women who go through depression, is that usually it's about the now,
yeah,
and definitely what this pandemic or this lockdown has taught us, that we can't even figure out or fathom tomorrow what's going to happen. What
yes,
is really teaching us is now. How can
now,
we understand how to be in the now? And that's really the only way. I think what we're trying to say is, Chuck, it may be very hard messages, but you already have the answers because you're already living
yes,
it. And one of the important things is living in the now. You know,
Yeah.
if you can fathom, most of us can fathom what we're doing